Health sector experts have called for harmonization of Nigeria's pharmaceutical activities to prevent duplication of efforts, enhance efficiency, and improve access to quality medicines and health products. They made the call in Abuja at a high-level stakeholders' engagement on harmonizing pharmaceutical sector activities. Dr. Tayo Hamzat, Supply Chain Management Officer, World Health Organization, said the activity was timely given the number of ongoing interventions in the sector.
This activity is one that is required at this moment, with multiple interventions going on. At the risk of duplicating efforts, at the risk of running parallel programs, and at the risk of we going all over the place without concrete direction. Harmonization of the pharmaceutical activities will lead to faster access to health products. It will lead to lower cost, increased efficiency, and enhance regulatory oversight. So it will require engagement, which is what we are doing now. It will require collaborative efforts. But it will require focusing on strengthening national systems. So I plead with us that as we go through the process of this engagement, we take this into consideration.
Dr. Francis Onhaido, Director General of the West Africa Institute of Public Health, described the engagement as common sense given the need for resource optimization in an evolving development financing landscape.
One of the things we should not do is to waste resources. And one of the best ways to do it is to have these common conversations among us and to see what we are doing in our own different spaces. So as we are here today, I think I want to encourage all of us to really do clear stock taking so there are no duplications of work being done in the space. And one other clear thing that I want to also encourage us is the fact that market shaping is a critical tool for development. And Nigeria has done it very well in different, for some of you who knew during Onyebuchi Chukwu as Minister of Health, the UN had identified 13 commodity areas. And those target profile commodities were things that Nigeria went for, some of them. And that gave birth to things like chlorhexidine and amoxicillin DT, the dispersible amoxicillin for the pharmacists who are in the room. And it's possible. One of the potentials that this harmonization can do for us is to identify clear areas and gaps that we can fill for the Africa Continental Free Trade Area, because it's a large market space that is waiting to be tapped by our pharmaceutical sector. And if we do it right as Nigeria, I can assure you, we will take over that system generally on the continent, because we have the numbers, we have the capacity to do it. But harmonization will be the key word for all of us.
Dr. Anthony Ayeke, Program Manager for Health and Nutrition at the European Union Delegation to Nigeria and ECOWAS, said the EU remained committed to fostering a robust, locally driven pharmaceutical sector.
By harmonizing our activities, we can accelerate local production, reduce dependency on imports, and enhance the resilience of Nigeria's healthcare system. Some suggestions that we may want to consider as we look at this review stakeholder meeting could include enhancing regulatory frameworks, and this will mean streamlining approval processes to fast-track the availability of essential medicines. We can also look at capacity building, which is one of the components of the interventions we will be having with partners that we have engaged in the pharma sector. Capacity building to strengthen technical expertise across the pharmaceutical value chain through targeted training and knowledge sharing. And this also includes addressing industry skill gaps.
Dr. Abdul Mukhtar, the National Coordinator, Pharmaceutical Value Chain Transformation Committee, represented by Dr. Muhammad Balarabe, Technical Associate at PVAC, commended ongoing efforts under the Impact Project.
Let us leverage this platform to strengthen partnerships, optimize resources, and ensure that every intervention aligns with the overarching vision of affordable, high-quality healthcare for all Nigerians.
The Director General, National Institute for Pharmaceutical Research and Development, Dr. Obi Atigwe, represented by Professor Philip Builders, Professor of Pharmaceutics at NIPRD, said fragmented interventions, regulatory redundancies, and duplications had hindered sector growth for too long. The meeting was attended by government agencies, development partners, and industry stakeholders, all reaffirming their commitment to unified efforts in strengthening Nigeria's pharmaceutical ecosystem.
As many of you are aware, equitable access to quality medicine is the bedrock of universal healthcare coverage. Yet, millions of Nigerians still face barriers in accessing essential healthcare commodities. This is not simply a health challenge. It is an issue of equity, national security, and economic survival. That is why today's engagement is not just timely, it is mission critical. Harmonizing is not merely about filling gaps or avoiding duplications. It is about creating a synergy where policies, investments, and technical frameworks are deliberately aligned to deliver measurable outcomes for our people.